Hi everyone, I'm Damian Jenkins. I'm one of the tutors in medicine here at St Hugh's. I've been asked to say a few words about life here in college and at the local hospital where I work and have been caring for people during these unusual times. By way of a background, I'm a consultant neurologist and I tutor in physiology and pharmacology to both the medical and biomedical students. So coronavirus struck as Hillary term drew to a close. Little did we realise at that point that we'd be saying goodbye to our students for about 6 months. In fact, we were gearing up towards the second years taking their exams and the first public examinations for the first year medics and biomedics. Of course, it rapidly dawned on everyone that coronavirus was not a passing entity and was likely to stay with us for some time, and college had to re-gear itself to provide tutorials and pastoral care remotely. And how did that work out? Pretty well, I think. Our tutorials online, technological glitches aside, turned out to be quite good fun. Naturally, the lack of tea and biscuits and the inability to squish 3 people onto a 2-seater sofa removed some of the joy of the tutorial, but nonetheless it's been really nice to be able to see people's faces and hear their voices and really to continue that all-important sense of fellowship that we have in college life. Whilst catching up on live tutorials works pretty well, the pandemic has left college itself feeling a little forlorn. There are no students on the lawns, there are no staff smiling as they go about their business, keeping our wonderful home as it is in good shape. And there are no smells from the kitchens, there's no summer ball planning. Instead, there's just empty space and silence, which is kind of a monstrous shame as the gardens have never looked better. And of course, at this time of year, our students have normally vacated actually, and their rooms are given over to the conference season that's so important to our financial footing. And of course, it's a real worry to those of us in college about what the long-term future holds for us with the effects of coronavirus on our conference income. Now, aside from the tutoring, I've spent much of the last 4 months right at the heart of hospital care, looking after patients with COVID-19. In April, actually, I was redeployed from neurology to general medicine in order to work right on the front line. This seemed quite daunting to me. Neurologists in the UK do not practice general medicine, and actually it was 8 years ago that I last actually worked in general medicine. But much of my fear was kind of knocked aside by the fact that I was getting to work with 2 other lecturers from St Hugh's, Dave Holdsworth, who's a consultant cardiologist, and Laura Watts, who's actually gave up her own time in research in which she's doing a doctorate in rheumatology to come back and help out, roll up their sleeves and look after the patients who are most in need. Many of our students also had to roll up their sleeves because our final year medical students were kind of deprived of being able to go abroad. Part of the medical course involves an elective in which you spend weeks in a different country taking part in their healthcare systems, and they were deprived of that because of the lockdown. But they did willingly take up the role of becoming interim foundation doctors. This was a new role created by the GMC for which they had to be fully licensed, so the university had to bring forward its graduation for the medical students for that to happen. Unfortunately, that meant, of course, that they graduated in absentia, and I really do hope that their willingness to muck in and help out doesn't go ignored by the university, and that they do get a degree ceremony in person so that they can get back together and see each other for one last hurrah. Now, this is also the first time I'd actually got to work with any of our students in any numbers, and I was really moved to see how they developed. They're really no longer those lovely, awkward teenagers that we admitted 6 years ago. They're now adult, kind, compassionate, and really extremely capable doctors. And if ever I needed any form of reassurance about the role college plays in educating the fine young women and men that it admits, then I got that in spades during this period. Now, the clinical work surrounding COVID-19 was pretty unusual. We were effectively describing and defining the disease as we went along. And of course, that remains a work in progress. And alongside those difficulties, which are really just purely medical ones, there was actually significant sadness. And I think in 15 years of doctoring, I've never seen the sick and dying deprived of the love of their families and their friends. And of course, the hospital tried to bridge that gap, but there's no way that seeing your loved one for the last time on an iPad is in any way, makes up in any way, sorry, for being able to see them in person. Plenty of my colleagues spent hours overnight holding the hands of those who were in their last hours. It's something I hope to never see again. So Fortunately, Oxford was not actually that badly affected, by comparison at least to other regions across the UK. And also life at the hospital is effectively returning to some form of normality. Of course, we now have to pick up the ball and catch up with all the work, the normal workload that we did not achieve over the past 4 months. And of course, the biggest effort is now ongoing in the labs, where our biomedics are working hard on vaccine trials, understanding the immunology associated with coronavirus, and looking for effective treatments. And we're all counting on their success. I hope that college can also look forward to some form of normality returning, and there are tentative plans to get the students back in Michaelmas term, and I really hope that that happens. I'm also really hoping that our staff who have been on furlough and sad not to be seeing each other and getting on with their usual daily jobs, I'm looking forward to seeing them back too. I hope that provides you with a little bit of an insight into what some of us at college have been doing during these unusual times. I hope that you and your families remain well, and it'd be really nice to see you in college when that's next permitted.